Thank you for joining us for today's webinar, which is Understanding and Supporting the Mental Health and Well-Being of Workers During and After the COVID-19 Crisis, presented by Wilfrid Laurier University. My name is Allison Mitchell, and I'm part of the Greater Kitchener-Waterloo Chamber of Commerce team. Before we start our webinar, there are a few housekeeping items that I would like to share. Your microphones should be muted, but if you could please double check to ensure that they are to reduce background noise, we would appreciate it. Please feel free to ask questions throughout the webinar by typing them into the questions box in the control panel. Our presenter will be answering your questions at the end of his presentation. As a follow-up, all webinar registrants will receive a recording of the webinar after the webinar today, and there will be a link to the webinar recording. Our presenter today is Dr. Simon Coulombe. Dr. Coulombe is an assistant professor in the Department of Psychology at Wilfrid Laurier University and the director of Flourishing Communities Research Group. He also has an appointment in the Department of Industrial Relations at Université Laval. His research focuses on the well-being of diverse communities facing precariousness, including students, LGBTQ2S+, individuals, immigrants, people with mental health issues, and in precarious employment conditions. His most recent research focuses on the impacts of the COVID-19 crisis on the mental health of workers across Canada. His work highlights the importance of creating inclusive and supporting workplace environments to promote resilience and optimum human functioning for all. I would now like to invite Simon to begin his presentation.
Thank you for being here, and thanks to the Greater Kitchener-Waterloo Chamber of Commerce for inviting me to this webinar. As you can see, and you can probably guess from my name, I'm from Montreal, so I have a French accent. So if at any point you want me to repeat something or to clarify something, feel free to ask me in the chat, and I'm going to be happy to clarify. So it's really a pleasure to be with you today, virtually at least, and to get to talk about this important topic for me and for several of us, I would say, in the current crisis. So today, the agenda for the presentation, for the webinar, first we're going to talk about why focusing on mental health and what is it? What is mental health exactly? What do we mean by this? And then we're going to talk about important workplace psychosocial factors that are driving mental health in the workplace. We're going to talk a little bit more about work-personal life conflict or balance and the issues of techno stress, so stress related to the use of technologies that could be elevated right now due to what's happening with the COVID-19 crisis. And finally, we're going to talk a little bit more about some forms of self-care practices and intervention that workers, managers, like everyone actually could implement in their daily life to help alleviate or reduce the stress of the COVID-19 crisis or to help deal with the stress. So that's the agenda for today's presentation. Let's start with the first part of the presentation. So why focusing on mental health today? Why? I think it's not gonna take a lot of time to. I'm not gonna take a lot of time to convince you, but there's definitely signs that in the current context with this unprecedented crisis pandemic that we're experiencing, our mental health is starting to be compromised by the current situation and by the social distancing measures and the vulnerability that some of our friends and colleagues have working, and vulnerability to contracting the virus, etc. So there's been a research, for example, in Ontario, showing that Ontario residents are now, they feel that there's going to be a mental health crisis. They feel that mental health has been reduced or is currently being challenged by the COVID-19 crisis and the impacts of the crisis and different aspects of their life. There's also research that's been done by Statistics Canada. They did survey research in which they were able to see that fewer Canadians report that they have excellent or very good mental health. compared to usual. But overall, Canadians report better physical health during the crisis. So it's interesting. So it seems that mental health is particularly impacted by the current crisis, and it seems also to be something that's starting to be recognized more globally. So, for example, the United Nations a couple of days ago only indicated that they are fearing that there's going to be a global mental health crisis following or accompanying the pandemics. So it's globally a situation that at different levels, at the Ontario, the Canadian level, but also throughout the world, that people are starting to get a little bit anxious about, but also they're starting to try to put the measures in place to either prevent this from happening or to develop the best programming and services and supports for Canadians and people around the world living with the current situation. So obviously, the current situation is creating lots of changes in our lives, like at the personal level, at the professional level, family level, plus our health could also be affected by COVID-19, for example. So it's a lot of factors and stressors that are accumulating, thereby impacting the well-being and the mental health of people. So that's why it's important. It's an important topic to consider. And while it's super important to consider physical health and to prevent COVID-19 from to try to stop the pandemics and to find a solution to COVID-19 and the virus, it's also super important to consider mental health as an important part of well-being and health. We did our own survey with a student, Tyler Pacheco, working in my research group. We started a survey actually between 1 and 2 weeks after social distancing measures were implemented. We're able to collect data from almost 1,200 participants, almost 1,200 participants in Canada. They were all workers before the crisis started. And we found that in these 2 first weeks after social distancing, the levels of anxiety and depression symptoms were very, very high. I mean, I don't want to scare anyone, but it's 60% of the sample reported moderate to high levels of anxiety, and 42% reported moderate to high levels of depression symptoms. I mean, in normal time, if someone would report such a level of symptoms over a certain period of time, for more than 2 weeks, for example, they would be technically, a doctor would recommend them to maybe get assessed for anxiety or depression disorder. In the current situation, we must recognize that it's probably more, at that point, at least, it was probably more a matter of adjusting to the situation. So I wouldn't say that these people are all living with anxiety and depression, but it's still concerning that the levels were that high, particularly for anxiety. So we followed these people through time, and we did another round of survey 3 to 4 weeks after social distancing measures started. And we're able to see that, that's positive. The number of people reported experiencing moderate to high level of anxiety is lower at that point. So 36% of the sample at the second wave of the survey reported high moderate anxiety, and 32% reported moderate to high level of depression symptoms. These numbers are still relatively high. It's still like a third of the sample that's reporting such symptoms. So it's definitely concerning, but it's also interesting to see and important to recognize people's resilience and capacity for adaptation and adjustment. So it seems people at that point maybe started getting used to the situation. We're following the same participants again, actually today or tomorrow. They're going to start a third wave of the survey. So we're going to be able to see if the situation is getting better or worse, and what are the factors driving the mental health of these workers. An important finding for us, and I mean, it's not necessarily surprising, but it's important to have data to back this up, is that people who've lost their job temporarily, because in our sample at that point, at least at wave 1, we didn't have a lot of people at that point who lost their job permanently. But the people who lost their job temporarily at that point, they were experiencing higher anxiety and depression symptoms. So workplace related conditions, employment related condition is definitely affecting how people react to the current situation and how people adapt to the current situation. So it shows the importance of considering all the changes that are happening in people's different spheres of life, including work, because it can impact their mental health and well-being. What is mental health? Mental health has long been considered to be mostly not having depression, not having anxiety, etc. So for a long time, people, psychiatrists, psychologists, and the general public have considered mental health to be not having any mental health issues. But if we also go back a long time ago, the World Health Organization has defined health as more than the absence of disease. So health is a state of complete physical, mental, and social well-being. So it's not fair to consider that mental health is only the absence of depression, for example, or the absence of burnout. Mental health is more than that. So in order to fully capture what is mental health, we need to consider both what I call positive mental health, what some other people do, positive mental health, but also we need to consider mental health issues and mental illness. And these two things are not simply two opposites on the same dimension. They're actually two different dimensions. I'm going to explain this in the next slide. So to understand mental health, we need to consider both the absence of distress and mental illness. And you can think of different forms of distress and mental illness. It can be a clinical diagnosis such as anxiety, depression. In the workplace, although it's not an official medical diagnosis, in the workplace, we often think about burnout as being a mental illness or like some form of a mental health disease. So this is what lots of people are thinking when we say mental health. But mental health also encompasses what's called positive mental health. And positive mental health refers to positive well-being in terms of your emotion, your psychological functioning, and your social interactions with people, your social well-being. And all of this can be considered in general in someone's life, but also positive mental health in the workplace, for example. To show you a little bit better what these two sides of mental health mean, and these are two relatively independent sides. They're related, but they don't necessarily always co-occur. So someone could have a low level of mental illness, but still experience a relatively high level of positive mental health, for example, or they don't necessarily relate. So just to give you a better sense, and you probably, maybe most of you or some of you already know the symptoms of burnout, but it's just to show you a couple of symptoms of burnout. Burnout is one of the most related mental health issue related to the workplace. And we know it's related to lots of psychosocial factors or conditions of the workplace that could be right now affected by the crisis. So burnout includes physical fatigue, cognitive weariness, emotional exhaustion. And here you see a couple of items from a questionnaire that's used to assess burnout, asking people to answer this question. I just put these questions here so you can get a better sense of physical fatigue, such as I feel physically drained, cognitive weariness, I feel I'm not thinking clearly, and emotional exhaustion, I feel I'm unable to be sensitive to the needs of coworkers or customers or clients. So all these different signs, we need to be currently in the current context, we need to be careful about potentially seeing these signs in our colleagues or employees or supervisors or people around us in the workplace and our family members who are workers, because there's we think, and other researchers also think, that the current situation could be exacerbating existing burnout issues or actually contribute to the development of burnout. So this is the mental illness side of mental health. And the positive mental health, something to also consider, and sorry, I just forgot about that, but so burnout here is seen more as physical fatigue, cognitive weariness, someone who's exhausted by too much work and the workload. that's too much, or that the environment that's asking too much. But there's also a similar or related issue that's called being bore out, in which people feel they're lacking stimulation, they are disengaged from work, and they feel they lack meaning in their work. I just found it was important to consider that today in the presentation, because we know some people cannot work right now and are stuck at home, or can only do part of the work that they usually do, and the work that they have can lose meaning. We know meaning in life and meaning in your work and different activities in your life is important in well-being and mental health. So it's also an important aspect that could manifest itself right now, some bore-out syndrome. In terms of positive mental health, so it's the positive side of things. So these are questions that are used by Statistics Canada to measure positive mental health, just so you have a sense of what it means. So feeling happy, interested in your life, satisfied with your life. Then you have a bunch of questions that are focused on the social aspects of well-being, feeling you add something important to contribute to society, that you belong to a community, that people are basically good. And then you have a bunch of, from number 9 to 14, you have questions related to psychological functioning, such as your confidence to express your ideas, the feeling that your life has a sense of direction or meaning, feeling that you like parts of your personality, you're good at managing responsibilities of daily life, etc. So all these different aspects are what we call positive mental health or positive well-being. So someone who say that or report experiencing these different things frequently in their life would be said to have a high level of positive mental health. And other people have developed similar skills to think about the situation specifically in their workplace, the experience of these different things in their workplace. And like I was saying, positive mental health and mental health disorder symptoms or mental health issues symptoms, such as burnout symptoms, they are relatively independent. So someone who would be experiencing low level of positive mental health and a high level of burnout would be, we would say, would be non-recovered from their burnout. But someone who's experiencing high level of positive mental health and low level of mental health symptoms would be completely recovered. But you also have partial states in which someone is experiencing high symptoms and high positive well-being, which is a little bit surprising, but we know in the population that group of people exists, people who are still able to find joy in their work, while at the same time experiencing symptoms of depression and anxiety in other aspects of their life, etc. And the importance of looking at this today is that the current situation might affect the positive mental health differently than the distress and the symptoms of illness. So if we want to promote promote mental health and well-being in the current context, promote this in a comprehensive way, we need to look at both dimensions. And it kind of brings us to this next slide that talks about when we look at research and intervention related to workplace mental health and workers' mental health, research has usually an intervention, and practitioners, policymakers usually use different approaches depending the field that they are in. So in the field of occupational health and safety, people usually focus on prevention. So the idea is to prevent risk factors for negative mental health issues, so for depression, burnout, etc. So if you do primary prevention, you reduce risk factors in the environment. So you reduce stressors in the environment. But there are other forms of prevention that are that are not reducing the stressors, but providing tools or skills for people to deal with the stressors or the risk factor in the environment and not develop mental health problems. And another whole approach has been developed more by organizational psychology, organizational development, positive psychology, and it's more focused on developing workers' strengths and creating health promoting environments. So that part is more focused on promotion. So promoting mental health more broadly, and it's a little bit more aligned with the positive mental health idea versus what you see on the left. The prevention part is usually more aligned with preventing problems from happening rather than broadly focusing on promoting a holistic well-being and mental health. So in the current situation today, we're going to talk a little bit about both, some prevention approaches and intervention that can be implemented in the current situation, and some promotion approaches. So let's talk about workplace psychosocial factors. And sorry, there was noise behind me, so that's why I was making this face. Workplace psychosocial factors. These are key drivers of mental health challenges and positive mental health in the workplace. So just to give a bit of background around where do we see psychosocial factors fitting in the bigger picture, psychosocial factors are one part of a larger model of mental health. Several people right now in the world of like mental health field and like psychiatrists, psychologists, counselors, several people right now agree that this is one of the most comprehensive way to look at mental health. And it usually includes the interaction between several types of factors. So biological factors, so vulnerabilities that people have that may be due to their genetics, for example, vulnerabilities to develop depression, anxiety, etc., burnout. But it's interacting with factors in the environment and social or environmental factors that in different environments, so the workplace, but also family environments, etc. And it's also interacting with psychological factors. So the way people assess the situation, the meaning that people give to a stressor in their workplace, for example, and all these different factors interact. So right now, what's happening with the COVID-19 crisis is that it's changing the environment in which we live and work. So it's actually changing the social or environmental factors. But the way it's going to affect each of us depend on our own biological vulnerabilities, our own way also of interpreting the situation based on the way we usually cope with stressors, etc. So psychological factors. But it's recognized that from a prevention perspective, and I know several of you on the call might be employers, managers, or employees, and from a legal perspective and a prevention perspective, employers have a duty to provide a safe environment and a secure environment that's why I want to focus a lot right now on the social environmental factors that in the current crisis can be exacerbated and can be risk factors for developing mental health issues. So that's where these workplace psychosocial factors that I'm going to discuss, that's where they fit in the larger story of and the larger model of what's involved in developing mental health issues. The larger context is that I don't know if you're familiar with this, but it's a national standard of Canada for psychological health and safety in the workplace. It's basically a norm that's voluntary, that's voluntarily applied. So it's not all organizations. Organizations don't necessarily have to implement this norm, but it's a norm that's been developed by the Mental Health Commission of Canada, the CSA group, and other groups across the country. And it basically states that there are 13 workplace psychosocial or environmental factors influencing mental health. And not workers, but employers and work organizations who are interested in promoting the mental health of their employees and protecting their mental health can get access to this norm and implement this norm. And these factors, these 13 psychosocial factors, are actually on the next slide. They're coming from lot of research that's been done in the past. Previous research that's been done around psychosocial factors in the workplace that can promote or hinder well-being. It's a group of researchers in BC that has developed the classification initially. It's the group that's called Guarding Mind at Work. For those of you who are interested, I don't know if you see it, but at the bottom of the screen, there's a URL, a website address where you can go to see the Guarding Mind framework. And they basically define on that website the 13 different factors in detail and give strategies that employers, managers can implement to support these different factors. In that classification, these factors are all considered to be protective. We see these factors as positive. But if these factors are lacking, then they become like the situation becomes a risk for developing mental health problems such as burnout. Actually, lots of these different factors have been related in previous research to burnout as a mental health issue that's kind of that's emerging from these different factors. So that can be created or that can develop itself because of these factors. So I'm not going to read all of the factors, but some of them are particularly interesting in the current situation, interesting to consider. For example, clear leadership and expectation. It's really possible that if you work remotely, for example, right now, you might feel like you don't receive the usual level of supervision and the usual level of clarity in terms of what's expected of you. So this reduced level of clarity could impact your mental health and your well-being. Opportunities for growth and development. On the one side, some people would say that the technologies and the fact that they need to work remotely and to use new technologies can provide new opportunities. But on the other side, it seems like everything is kind of on hold right now. So aside from dealing with the emergency, opportunities for professional development, etc., might be lacking right now, or like formal classes that you were supposed to take or go to a conference maybe. It's usually on hold or happening online, which it can reduce the positive experience. Balance is an important one. I'm going to come back to this one, but it's basically referring to the balance between different aspects of one's life. So work and family balance versus work and family conflict. So as you can see, all these different factors, and I don't want to define all of them right now because it would take a long time, but all these different factors provide kind of an important framework or an interesting way of looking at how the COVID-19 crisis is impacting ourselves as employees or workers or managers, but also impacting other people around us in those different workplaces. Like I already explained to you, there's actually I'm from Montreal, like I said, and there's a National Public Health Institute in Quebec, and they basically, and you can access this. This one is only in French though. They basically recently published just a 1-page or 2-page document, exactly highlighting what I just said. This idea that the COVID-19 crisis is likely impacting factors in the environment, thus creating more risk for mental health issues. So they are saying basically that the COVID-19 crisis is probably changing the workload that people have. So sometimes some employees are not working anymore because they had to stay home because they were, let's say, over than 60 or 70 and they were at risk of getting COVID. So it means that other people might work more right now. Usually the fact that we work remotely for several of us means that we have less support or less real life interaction, at least with supervisors. And usually it leads to less support from supervisors, but also colleagues interact. I don't know, personally, I interact much less with colleagues right now than usually. Lack of recognition. So recognition sometimes can just take the form of meeting your boss in the hallway, and your boss might say, "Oh, you did this. It was good," or "Yeah, thanks for doing this." So recognition doesn't have to be a big thing, but these kind of minimal, spontaneous interaction where recognition could be offered are probably now lacking in our current context. Also, as part of recognition, salaries and income is a form of recognition. Of the quality of one's work. And we know that right now there are lots of issues happening with job insecurity, and potentially some of us are trying to negotiate, some unions are trying to negotiate increase in salaries, etc. So there are changes to the recognition framework or regime that is used within different organizations. So it's also impacting mental health to some extent. And usually there's also a lack of decisional autonomy. Decisional autonomy means that employees, it's usually good in a work environment if employees have the opportunity to say what they think about how the business is running and the work that they have to do and important decision the organizations is making. And right now, because the organizations are operating in more of an urgency mode, it's likely that people are probably less less involved in decision making, and like I said, also less opportunities for growth. So all these different factors we fear, and there's not a lot of data right now. You would understand that we're still studying all these different things, but people are worried that it's going to ultimately affect the mental health of workers and the well-being. And we see signs of that already from the research that we did, and I mean from more anecdotal evidence in our conversations with workers right now. So what the Quebec Public Health Institute is recommending, and I agree with these recommendations. That's why I think I decided to present them to you. And I cannot, I mean, they are an authority in this field, so I think it's interesting to also follow the work that of different organizations who've taken the time to develop these recommendations. But first, for managers to develop new communication channels or strategies to really stay in touch with employees. So it could be regular online meeting, but also meetings in which there are transparent discussion and empathetic interactions. So we know everyone is, several people are stressed by this situation, don't really know the future, what's going to happen in the future, when we're going to go back to normal life, if we ever go back to normal life. So people are stressed right now. So communications styles need to be adapted to this. We need to develop more of and it goes with the second point, more of a culture of support and culture of compassion in the workplace. And we also, as managers, we need to try to model this. Because if we expect that workers between themselves are going to be creating this culture, and if the manager or the leader is not supporting that culture, it's going to send basically the other message, and it's going to likely fail the creation of this supportive culture. The third point related to the workload and having clear expectation, it's important that employers work with the employee to develop clear guidelines, clear expectations, but also give them adequate tools and supports to do their work. And tools could be access to Zoom, for example, or a meeting platform, but also giving them opportunities to get trained in using these kind of technologies is an important thing to do. Recognition is important, and if it could, developing strategies such as sending recognition emails or emails in which you give feedback about the work that's been done. And I know it's hard. I'm myself managing a research group with lots of different students, and it takes a lot of time to build these kind of communication channels and mechanisms. But I think it's very important that people feel that they are encouraged. And I'm not telling you not to be authentic. So I mean, it's okay to provide constructive feedback, but also recognize the effort that it takes in the current situation to continue working and to continue to be productive despite all the stressors that are happening in our current environment. And finally, if it's possible, to try to consult employees on important decisions that are made and that concern them. For example, it could be through email chains, or it could even be through a short survey on Google Form, asking people for feedback, etc., showing that you care about their feelings, their mental health, and their well-being. So even just communicating to them that it's an important issue that you're thinking about in terms if you are a manager, etc. So I think these are all important recommendations. And to some extent, some of these recommendations, I would suggest that based on previous research, they should be used in more like, they should become part of the general culture and be used at all times. But at the same time, we know right now it's particularly important to implement these different recommendations, and to maybe see the current context as an opportunity to have more of a reflection about these different aspects. For example, have a reflection about these 13 factors. If you think about your own current workplace environment, what do you see do you see that there are some of these factors that are going really well and some are not doing well? What could be done, etc. And actually, if you go on that website, Guarding Minds at Work, you're going to find lots of resources like a survey, a questionnaire that you could use to assess from your own perspective the environment, or if you're a manager, you could have people, other employees from the organization completing this survey. And it could be very helpful. And they also suggest different things that could be done if you find a lower level of some of these factors. I wanted to take a couple of minutes to talk a little bit more about work-personal conflict and techno stress. Work-personal conflict, like I said, is related to one of the 13 factors, the factors that call balance. So it's really the balance between work and personal life. And in our survey that we did with almost 1,200 participants, we asked them in the second wave, at both waves, sorry, we asked them their level of agreement with the statement that you see. We asked them, we said, I stop in the middle of my work to address family concern, and 42% after 1 or 2 weeks of social distancing, 42% were in agreement with the statement. When we did the same survey a little bit later, 2 weeks later, 47% were in agreement. So it means 47% of people who participated in this survey were affected by their family life while working, almost 1 out of 2 participants. So it's a very high rate of work family conflict. And I'm not saying this at all to blame families. I think I'm just saying this to highlight that this is an emerging and important need. And as part of creating discussion and meetings and supervision opportunities, if you're a manager, as part of this, I think it's an important thing to raise the work-personal balance issue. Are your employees having issues managing work and personal balance? Because we know it's associated with job satisfaction, productivity, mental health, etc. One aspect of the current context that might be contributing to work personal life conflict is actually technologies. There's a concept that I'm going to define on the next slide that's called techno stress, but it's basically to what extent do you feel that you are stressed by the use of technologies in your work? And I mean, people could have been stressed before the crisis started, but I think right now people are more and more relying on technologies in the current context. And I think 40% of the participants said that they were in agreement with the current statement. Using this technology blurs the boundaries between my work and my home life. So there's some problem with the permeability of the workplace and home spheres of life right now in the current context, and technologies seem to be kind of increasing this issue. We also measured other aspects of techno stress, and we found that more than 1/3 of the participants experienced moderate to high levels of techno stress 3 to 4 weeks after social distancing started. So it's definitely something that we need to continue to look at to better understand the impact of techno stress. But so far, we found that the more people felt they experienced techno stress in their life, the more anxiety and depression symptoms they experience, showing that it's an important factor to consider, especially in the current context. Techno stress can be related to lots of different factors. And I'm not going to define all of that, but these are 5 different things related to stressors, to technologies that can create stress. So techno overload, so it's this idea that you feel like you work more and you have to work more because of technologies, because it's basically allowing you to do things more quickly, but in return, then you have more time, so you should do more work. Invasion it's invading your personal life. Techno complexity means that you feel you don't necessarily have the competence to use the new technologies, and it's creating a stress. Techno insecurity is not that related to the current crisis. I would say it's the fear that you're going to lose your job due to the use of technologies, and technologies replacing humans, basically. But techno uncertainty is also interesting. It's the uncertainty associated with technologies, and the fact that we always learn to use the technology, but we need to, it's always uncertain how long it's going to last. And we know we're going to need to learn the next one because they're going to release a new version of the technology. But definitely right now, I would say that the first 3 at the top are probably affecting workers in the current situation. Obviously, we're going to need some empirical work, research to confirm that, but it's likely that these three at the top are being exacerbated right now by the current situation. But there are strategies that organizations can implement to mitigate these forms of techno stress, such as providing technical support. So there's research showing that if organizations better support the employees to when they have a problem with technologies, it's actually reducing techno stress. Literacy facilitation means helping employees develop knowledge about how to use the new technologies, etc. Providing them with training opportunities is an important aspect that could reduce techno stress and thus reduce mental health issues and promote well-being. And involvement facilitation is a big term for just to say that whenever there's a new technological choice that's made in the organization, whenever there's a new technology that's introduced, try to involve the workers and the employees in making that decision. Try to empower themselves in being part of the decision and empower themselves in kind of making sure they understand that they are on board with using this new technology. I know in the current context that one is not easy, because we've been all forced to use remote work technologies right now. But I think providing literacy support, technical support is very important to reduce techno stress in the current context. I feel I'm talking a lot. I might not get to go through all my slides. I'm gonna try, I'll see. So what we've been discussing so far are the 13 psychosocial factors in the work environment that may have been affected that may be affected by the crisis, and in turn it could impact well-being. So we've been focusing a lot on what we can do in the workplace environment to try to improve these factors so people would be less affected by well-being. In the next few slides, I want to talk more about the promotions type of thing. So the more what people themselves can do to promote their mental health and well-being. And I'm not saying this in an individualistic way. I think people themselves, we can all do things to get better, to feel better. But it's also important that our organizations and people around us try to support us in doing that. You probably all know about mindfulness, so I might go quickly. But yeah, I want to say what we're looking at right now is more on the promotion side of things. So mindfulness is it's basically just means being aware of what's happening right now for me with an open, receptive attitude. And it's about regulating our attention toward the present experience, about not judging ourselves for how we feel, what we think, but being kind of curious about it. Not trying to get rid of what's painful, what's stressful, not being resigned about it, just observing what's happening in ourselves with some curiosity and gently observing it. So that's the idea of mindfulness. And the present experience encompasses lots of different experiences, such as body sensations, emotional reactions, mental images, mental talk, even perceptual experiences, so sounds, smells, what we see around us. These are all present experience. So when I say being in contact, observing our current experience, it includes all these different forms of our experience. And we know that as human, our mind actually wanders a lot. So about 47% of the time, our mind is wandering from the present experience. It's not actually in contact, observing what's happening, and it's been linked with experiencing less happiness, less well-being. In contrast, when we are mindful, when we are observing in the present experience, we are likely to experience more happiness, and it's been demonstrated in a lot of different research. So based on that principle, inspired by Buddhist traditions, so there were lots of mindfulness interventions that were developed. So in the last 3 decades, psychological scientists started to be interested in the importance of mindfulness and developing such programs and intervention. But it's based on Buddhist concepts. So we really psychology people didn't invent anything here. It's based on Buddhist scholarship on similar concepts and intervention before. But the way it's used right now is more secular. It's not necessarily religious in the current context. One of the most well-known mindfulness program is called the Mindfulness-Based Stress Reduction. It's 8 weeks of work that are facilitated by a teacher. So one session per week for about 2 hours, if I remember well. There's an audio guide that we can use to do a practice at home or in the workplace. And there's usually even a one-day retreat. Initially, it's been used with people with chronic pain, but it's been applied and it's been extended with lots of other population, including people with mental health issues such as depression, anxiety, personality disorders, but it's more and more used in the workplace also. So that's why I found it was interesting to bring this up in the current context. I wanted to do one activity. I'm going to skip because I'm not going to have the time to go through this activity with you. But what I'll do is I'll add the link in the slides, and you're going to receive this slide. But it's basically a link towards a video by John Kabat-Zinn, who's one of the main person who created that mindfulness-based stress reduction program. And it's a 5-minute meditation, formal mindfulness meditation that people can use to develop their capacity to regulate their attention towards the present moment. It just gives you an example of what's in that particular program. What's interesting is that it's been more and more applied in the workplace, and people in the workplace, we are aware that we don't necessarily have the time and have the resources to do a full mindfulness program over 8 weeks and etc. And there's actually research suggesting that even if it's adapted and it's more integrated in daily lives, and it's even if it's less, let's say it would be 6 weeks instead of 8, or it would be 15 minutes a day with audio guides only, etc. Research seems to support that it's effective in improving mental health and improving well-being in the workplace. So it's all of this to say that the table you see here is just kind of an inspiration for you to know what's in a mindfulness program. And mindfulness includes formal activities. Mindfulness programs include formal activities such as the meditation. But the idea is also that you can actually be mindful in your daily life. And this is what some people called micro practices. So actually at the bottom of the slide, you see Fezel and Chernis in 2020. Very recently, they published in the Journal of the American College of Radiology. They published basically just a short paper about the importance of mindfulness for healthcare professionals in the current COVID-19 crisis, and how it's hard for someone working in a hospital right now to take 2 hours to go to a mindfulness training session, but it's possible for them to do micro moments of mindfulness. So as you, let's say they suggest in the paper, as you wash your hand, as a doctor, you need to wash your hand right now, obviously in the current context, just try to be more aware of your sensation in your body or the soap on your hands, etc. So it sounds very, I would say sometimes I find mindfulness could sound maybe cheesy or could sound like too simple to be true, but there's definitely lots of research showing lots of evidence showing that it works to improve anxiety, reduce stress, distress, improve well-being, and also improves the sleep quality. And for example, there's a study here that's been done in which they basically summarized the results from 23 other studies. And all of these studies were focused on mindfulness specifically in the workplace, and they found these positive effects. Like I said, even if some of the workplace they made significant adaptation to the program, it still seems to work overall. So it's pretty impressive that such a small thing that could be done would be significant. Obviously, micro practices would need to be done in a more intense way for them to have a big impact. But the more formal programs, they seem to be working in the workplace. So that's definitely something that in a current context can be useful for people to deal with the current situation and to kind of be more in contact with the feelings that they're experiencing rather than trying to push them away, because we know it's usually exacerbating mental health issues. Related to mindfulness, and I'm going to end up this, is the concept of self-management. Self-management is basically the actions that we can take on a daily basis to manage our symptoms, prevent relapses from burnout, depression, anxiety, and optimize our well-being. Initially, it's coming from what I'm talking about here is coming from research with people with diabetes, but then more and more with research with people with anxiety disorders, bipolar depression. And we know that even if we suggest these people that they should go see a doctor and get proper medication, etc., we know that they can also empower themselves and take actions to get better. And more broadly, we think that similar strategies can be used by people overall, even if they don't feel depressed or anxious, but if they are feeling stressed, for example, in the current situation, they can use self-management strategies to deal with this stress and get better. We actually did 50 interviews with people with anxiety and mood disorder, and we identified more than 60 strategies that people use in their life. And based on that, we designed a self-management support tool. I'm going to show it to you in 1 second. It's basically an approach that people can use to try to recognize what they're doing already in terms of self-management. What is your self-management recipe? What are you doing on a daily basis that seems to work for you? And what doesn't work? And if you're not sure about what you can do, then you can look at the list of self-management strategies that other people are using and see if there are some strategies that you'd like to use and take action to use these strategies in your life. And then after a couple of weeks, you can review your strategy plan. And according to, oh, what was hard? Was it hard to maintain this strategy in my life? Did it work for me? Did I feel better at the end or not? And this self-management tool has been developed in Montreal, but it exists in both French and English. It's called Getting Better My Way. And it's been right now, actually, with the crisis context, it's been recommended by the Quebec, the Ministry of Health and Social Services, as one tool, important tool that people can use to deal with the current crisis. And what I'm going to show you is actually the PDF version of it. But by the beginning of June, there's supposed to be an English version that's going to be available online that people can actually create an account and develop their whole self-management strategy online. And we've used this with people in primary care settings, and it seems to be working well. People like the tool and etc. So there's research support for this tool. But basically, that's the tool. And basically, we see that there are lots of different strategies that people can use. Some of them are about their daily functioning. Some of them are dealing with anxiety, distress, or stress. Some of them are about your physical health, physical condition. Some of them about positive relationships with others. And some of them are more about hope and optimism. And the tool is basically like it's available for free, and you can work through the different steps. And you see, this is what I was talking about, the list of all the strategies that people have listed in our research. And we provide this list as a way to help people come up with strategies that they can use. So trying to make things that do things that feel good for them, setting realistic goals, staying busy to avoid thinking about difficulties all the time, dealing with your difficulty, getting help, trying to confront your fears or solve problems one step at a time. Some of these things, they seem simple and easy and obvious, but we know that people don't actually implement them as much if they don't have support to do it. So that's why a tool can be useful. Taking care of your physical condition, having a healthy diet, playing sports, having some downtime for relaxation, etc. Having positive relationship with other, getting with friends or family, attending a support group. And we know right now it would need to be online, but obviously this is something that people can do still online. Fostering hope. So actually mindfulness was part of it, using humor, avoiding comparing yourself to others too much, accepting the current situation that you cannot change it, for example. So, and based on that, you can develop your plan and develop a plan. And we know when we develop a plan to implement a strategy like this, we need to be specific about when we're going to implement the strategy, with whom, what are some supports for the implementation of this strategy, etc. Because we know these kind of more specific plans are actually going to help us achieve the implementation of the strategy. And then after a couple of weeks, you can review your strategies, etc. So the website, I'm going to go back to here. You see the website here at the top. you can actually email there, and they're going to send you the PDF if you want. But if you go to this website around the beginning of June, there's supposed to be an English version that's complete and available where you can develop your own plan on the website. So that's one way that you can take more control over your own mental health. And I know some of you are probably managers or leaders in different organizations. So as much as it's important to try to improve the conditions and the work environment of your workers, it's important that you take care of yourself and your mental health. And that's basically the goal of this self-management plan. So I'm going to stop here, but I just wanted to kind of raise more of the question for you at the end. How is the crisis impacting your mental health and that of your employees? What are the psychosocial factors in your work environment that may be driving these effects? If you think about the 13 psychosocial factors I talked about, and what can be done at multiple levels in terms of preventing more stress from happening to you and your employees, promoting their mental health more broadly, but also in terms of your own self-management. What could you do? And the importance in terms of self-management is to do baby steps. We know from research that if people set up goals that are too big to start with, it's going to be harder to stick with these goals. So doing baby steps to try to take care of your health in the current context or mental health. Thank you.
Great, thanks so much, Simon. So we just have a few minutes left. If anybody has any questions, again, please feel free to type them into the questions box. And Simon, I might start by just asking, I know you said that you have the third phase of your study happening this week sometime. Once you have those results, is there a way that we can access that? Because I think that it could be really interesting to see what's happening in the trends as we're working remotely more.
Yeah, we will make sure that these resources are sent out to different organizations. So we're going to write a fact sheet or something summarizing the results. So I can send them to you, and you can maybe include a link in your newsletter or something like that.
Sure, that would be great. Thank you. It doesn't look like we have any questions. I guess you've answered everybody's questions with your really great presentation. So thank you so much. I think the work that you're doing is really interesting, and certainly the COVID crisis and the remote working is having impacts on people's mental health and will continue. And so I really appreciate you sharing your expertise with us and your time with us today as we're all managing through the crisis. To our attendees, like I said, you will get a follow-up email with a link to this recording, and I believe we're also going to be sending out the slides, Simon's slides, so you will have the slides as reference. And again, thanks to Simon for talking with us today and sharing your research with us. Thank you.
Thank you. Thanks so much.
Thanks.